streaming live every day at 7 a.m. Pacific time. And today I thought I'll just wear a jacket so that way I can be a real doctor. Let's. So this is the way I'm going to present myself from now on. So that way everybody knows what I'm trying to convey the message, and I want consumers, patients to benefit from what I'm going to say and how to change the healthcare as we know it. Before we pick up a next topic, so basically, fundamental goal is to educate. Consumers Doctor is a volunteer for foremost organization, promotes education, promotes healthy families, healthy individuals, and how do you personalize your care through a health insurance, so-called is health insurance personalized by setting up personal care accounts. We do have there's called HDHP accounts. It's called it's a high deductible. It's renamed it as health disclosure, healthy pricing, healthy premium accounts. Once you set it up, you qualify to set aside HSA, which is Health Solutions Advantage accounts. That money which is put aside goes towards your personal care accounts, and that could be used for your future healthcare needs. What I see, where as things are changing in Washington D.C., but my goal is to educate you guys and bring them awareness on the healthcare. A lot of people have no clue what this HDHP, what this HSA. Have no, they have never heard of it. They only know basic facts, Medicare and Medi-Cal. That's it. They have no idea what the HDHP and HSA, which is going to be empowering the consumers. The goal is to empower the consumers, put them in the drive. When you have a $3.7 trillion budget, which is almost like a 17.8% of the GDP, obviously there are lobbies out there. They want to protect their interests. Obviously, when you have that kind of a budget, annual budget, which is year after year, Washington seems to be bent up on wasting that money instead of empowering the consumers and instead of investing in the Americans. They continue to waste year after year. The premiums, traditional health insurance premiums, they just evaporate. They just evaporate without any benefits back to the consumers. When people are taking care of their health, they should be rewarded, folks. They need to be rewarded. When people are taking care of their health, Americans need to be rewarded for their good behavior. Personal responsibility is a big thing in healthcare. So when we don't have personal responsibility in healthcare, things can go haywire. You can see obviously number one thing which we are facing is obesity in this country. Obesity, I'm not blaming anyone. I'm not saying they could be congenital, they could be, but what I'm saying, simple facts. Because number one problem in this country is obesity. For not taking care of, not focused on the diet, fitness, you know, things like that. So anyway, today's topic, let's pick up. Today's topic is quality of care. A lot of you people may be wondering, quality of care. What is the quality of care when you don't have a control? When the insurance company is telling you you can see only this doctor, or you can only see um, this facility, you can go only here, and you have a pre-existing illness and that's not covered. Where is the quality of care? That's what where I'm trying to address, and how it can be achieved. Quality of care. Quality of care is only possible when options to access care is provided to affordable health insurance. Insurance premiums have to be transparent, folks. There is no doubt about it. Insurance premiums have to be transparent. The way I see it right now, the the premiums are not transparent. Insurance companies dictate the terms, and you have consumers have very little choice. Very little choice. They have very little say. And with this public option, you will lose total control. You will not have a control. Basically, public option uh, is a disaster. What it will do is you lose control. Basically, government will be telling you what to do, where to go, whom to see, and it punishes people who are having a private insurance. This is where the problem comes. When you introduce a public option, it burdens the private health insurance markets. So that's one of the reasons why I'm saying invest, invest in Americans. That $3.8 trillion becomes 4.8, 5.8. This can't country can't afford. We already have what 25 trillion. God only knows what the debt is. We just can't afford 5, 6 trillion in healthcare. We don't have the money unless you keep printing the money, obviously. But how do you achieve quality of care? In real honesty, by by providing affordable health insurance. Personalized health insurance means easier access to quality care. Yes. And easier access to quality care means better treatments, especially people who are in the impaired group, people who are economically impaired, physically impaired, mentally impaired. Those are the people we are focusing on. The quality of care should be to the vulnerable. People are healthy, people are physically fit, their premiums have to be lower. But this is where our focus should be on people who are impaired, disabled, economically. They can't afford the premiums. We need to focus, and people are mentally ill. Most of them are in the lower socioeconomic status. And that's where our focus should be. And that's where we need to provide the best quality. I'm not talking about in general, I'm focusing on quality of care for the deserving people. Our focus should be who are the 3% of the population who really needs the care. And by giving this Medicaid, Medi-Cal, that is you're neglecting that main group of people. Basically, the Medical card, no, none of the providers wants to accept it. So you're basically neglecting, you're making, and your mental illness gets worse. And most of this mental health is almost like a, I'll, we'll talk about the mental health because it is it is basically considered as a physical health. So the parity, mental health and physical health, there's a close parity. So we'll talk about in another topic. So Institute of Medical Sciences, they conclude health insurance is associated with better health outcomes for adults with their receipt of appropriate care across a range of preventive, chronic, and acute care services. Yes, range of services. Adults without health insurance experience a greater declines in health status, die sooner than do adults with continuous coverage. So this is where the problem is. We need to focus on the people who are vulnerable by having affordable. The quality of care needs to be focused on people who needs the most, not average folks. average folks premiums, if they are not claiming, their premiums have to be low. But we are focusing on affordability factor for people with poor quality, poor health. That needs to be patient centric. The affordable care needs to be patient centric. The ripple effects of being uninsured and having poor health is felt throughout the society, irrespective of the class or creed. It affects it throughout the society. Yes, it does. And uninsured children have impaired development and poor school performance. It affects the country, it affects the nation. So the child mental health is very critical. We need to focus on children, future generation. Right now, our focus is not there. We keep fighting on this, public option. Unless you cooperate with the private enterprise, folks, we cannot achieve affordable care. We don't want to have one size fits all approach. I'm not sure what President Biden's plans are, but we want consumers. I'm sure there are a lot of insurance lobbies, they have their own interests. They want to protect their industry. So they may be in the Biden's cabinet. Anytime the insurance, basically the consumers are neglected all the way through because these lobbies control the industry, healthcare industry. Right now, lobbies through, again, I'm afraid I can say this, lobbies are pumping the money in the Democratic Party. They are pumping because they want to preserve their interests. The insurance industry, big pharma, and they're all invested in the Democratic Party. They want to control the healthcare, whereas the consumers are not given proper options. Consumers, unless they elect the right representatives, they will never be represented. They will never be represented. Okay, the thing about coming back to the quality of care, uninsured children have impaired development. Yes, impaired development and poor school performance, as I mentioned earlier. And uninsured children are 70% more likely to go without care for common childhood conditions such as asthma, ear infections, and sore throats. Uninsured children are 5 times more likely to have unmet need for medical care each year, folks. Each year, yes, each year. So these uninsured children takes the brunt, and it affects the future generation of kids. And no wonder we have a problem with mental health in children when they're neglected. They go through, and this, and when you liberalize the policy on marijuana, cannabis, and it gets into the wrong hands. I understand they wanted to lower the crime by introducing, opening up the marijuana industry, cannabis industry, but it's going to go in the wrong hands, folks. This cannabis, I'm not sure. Some of these states with the liberal policies, they're embracing because they want to raise money through cannabis. It all boils down to money, folks. Government wants to tax cannabis industry, so it's almost like a liquor industry. So they want to increase the revenue. That is enticing for all the states to liberalize the policies. Uninsured are 33%. Coming back to uninsured are 33% less likely to get a routine physical exams. 25% are likely to visit a doctor, actually 25% less likely to visit a doctor for illness. Uninsured. I'm not talking about uninsured. Yes. Uninsured women are 36% less likely to get a pap smear. Yes. And 60% less likely to get a routine mammogram. Screening is among the uninsured is 60% less. Routine mammogram, it is less likely. And uninsured men, 40% less likely to have the prostate exams, prostate screening for prostate, because that is a routine screening things which we need to address that, because uninsured population, they don't get routine screening, so they're just less likely to receive the care. That is so critical. We need to look into that. And if you want to provide a quality of care for, especially for the vulnerable, you need to have affordable premium through a public private. Again, I'm not advocating public option at all, because again, you don't focus on, when you get this Medicaid card, they're not getting the best care. Medical card, they're not receiving the care, because most of the providers and most of the institutions, they, folks, when I bill for 30 patients on Medical, I got a 1 cent check. So who in the right mind would to take care of the Medical? And they want to introduce Medical universally, and look, it just doesn't serve the intent. Our intent is to provide the quality care to the vulnerable, which we are not focusing on that. And uninsured adults have more absences from work. Yes, there are more absences from work, more unscheduled sick days, and greater rates of disability, folks. Greater rate of disability. In 2004, Kaiser Family Foundation studied, found the society cost, look at it, society cost for the uninsured care, roughly it came to $125 billion. Yes, that is the burden we have to take it, because it costs, as per the Kaiser Foundation, Family Foundation study, they said uninsured folks, it costs the society 125 billion, folks. Yes. And you want to introduce the public without any private corporations, without any private industries? I can't imagine just public option will serve, unless you want to tax the people out of the way, and average folks, people, you know, you want to tax the rich. I understand, the gimmicks. You want to tax everybody, yes, but how are we going to take care of the people who are uninsured? You can introduce all the public option you want. How do you address people? You want to give the Medicaid card who are economically not able to afford it, but they're being neglected. That's my problem. You cannot provide a quality of care for people who are vulnerable. That's our main focus, is quality of care for vulnerable uninsured group. Whereas personalized health insurance provides a specialized interest. Yes, specialized treatments for those most in need. Yes, and improved access to quality of care for all who seek it. Yes, all who seek it. There comes the personal responsibility, folks. Personal responsibility is a big factor in this. And almost Many Americans are responsible. You may be talking about less than 1% who cannot take care of their own health. But that's where the family structure comes in. Family structure is so important, man. This medical, I, this is what medical benefit. If somebody is getting a medical, they're afraid to get married because they lose the benefit. What does that got to do? Why do they have to lose the benefit just because their income level goes up and they lose the benefit? Come on, folks. You can't do that. Just want to get, you're encourage people to live together, have children, and they have, so they can keep have children out of wedlock. And what type of a future generation you're trying to create? I just can't fathom the the liberal folks thinking. I just can't fathom. When I was young, I was all youngsters are liberal. Obviously, they want to do good things in life. But as you age, people mature as you age, and the way I see it over the years, I have learned. I was a Democrat. I used to. The reason I became a doctor, my gratification was to take care of the people. That's what most of the doctors get into the profession. They want to follow the Hippocratic oath. But in the process, some of these doctors, they lose that concept. Once they see the money coming in, they want to get into full risk contracts. They want to grab that money from the federal and state government, and they want to take care of the full risk. And in the process, they're losing the simple concept of, you basically, once you get the risk contracts, very first thing you do is take away, curtail the services. That's the only way you can make money, folks. Curtail the services. Instead of that, give the consumers the personalized healthcare what they need, and give them certificate of guaranteed coverage to all folks, irrespective. Once you have a certificate of guaranteed coverage, it's a private insurance, folks. You can go to any private, they have no other choice but to accept it. So there's no discrimination, there's no bronze, there's no silver, there's no gold. These plans are discriminating, man. These are discriminating. When you introduce silver, gold, you're trapping the pool into the people into this category of class system. Why? Why do we need a class system when you can have personalized healthcare for all Americans? Guaranteed. Yes, guaranteed. Quality of care, man. This is so important. Quality of care. It's it includes quality of care includes good mental health, good mental health care for all individuals, especially among children. In 2008, Mental Health Parity and Addiction Equity Act was passed. It required employers with over 50 employees, over 50, this is called ERISA, over 50 employees to cover mental health the same way as physical health, folks. This is what it is. It's They equated mental health to physical health. Employees and the family members in smaller groups under 50 employees, group plans, need to have the same access as larger employer group, have to have the same access for the integrated mental health. I'm talking about a smaller independents, small businesses, individual businesses. They need to have the access in the pool so they can get the same care. If one family in the member has mental health problems, that should not affect the entire family. By You can segment that person and get the certificate of guarantee, and his premium is already guaranteed, so it should not affect the premium of a family. So family's premium should be the same as long as you segment one person out of that and give a certificate of guaranteed coverage. One truism exists. Yes, one truism exists. If an employer sponsored plan does not include stress management, this is a true fact, does not include stress management, you can be 100% certain that plan members will have their own stress management program. You can bet on it. Yes, 100% stress management. It is unlikely to be beneficial to have a worker's health or productivity. So, without structured stress management program, the most self-destructive stress reliefs are, again, back to the same thing. Most self-destructive stress reliefs are comfort foods, comfort foods, smoking, alcohol, drugs. These are the stress relieving factors. This is true because this is what it does when you person under stress. For them, these are the stress relieving factors, and that affects their performance. I want to restate the fact: most stress self destructive stress reliefs are comfort foods. Comfort foods. People with depression, they imbibe like crazy. They're craving for food. That's how they relieve the stress. And smoking, you're you're basically you're increasing your dopamine through your smoking, man. And alcohol does the same thing. It just makes you feel great. It relieves your stress. People do that all the time. There's nothing wrong, but you need to have a control. And the drugs, same. It destroys the families. It destroys the individuals. It destroys the performance at work. These are these. These are the stress relieving, and these are self-destructive. So what I see is most employers, most employers are beginning to understand the work effects of stress and depression. Yes, depression is underlying. No, it masks when a person does not know when there is a depression. He may not be aware, but the only way he can feel good about it by doing certain things, by smoking or whatever makes them feel good. Same thing with food. You know, when you don't feel good, you want to eat a lot of sweets, candies, or burgers, hamburgers, cheeseburgers, steaks. Yeah, you know, but they don't realize they're not. These are the self-destructive facts. So we need to focus on that. So employers have begun focusing on how to correct this stress and depression. Few employers, very few employers, fully grasp the debilitating impact on families from attention deficit disorders, ADD, attention deficit disorder, post traumatic stress disorder, PTSD, and other more complex mental illnesses, folks. It costs the health, the quality of care you can provide. It does affect, and it also increases the cost by not addressing simple things, folks, like stress. Cost of mental illness can go up Simple things. I'll give you examples. Again, we can talk about, maybe we should, let me finish it. So what are simple things like frustration, anxiety, low stress, dep- and minor depression? These are simple things that will lead to tobacco use, unable to sleep properly. You can have a cold or flu, and you can raise your blood pressure. That causes increased errors at work, and loss of teaming and presenteeism at work. So these are the simple, simple signals, man. Again, the medium cost. The other one was the lower cost. Medium cost, like these are the costs, but which I'm focusing on. Moderate stress, depression, anger, ADD, attention deficit, post-traumatic stress. These are the moderate, which can lead to hypertension, musculoskeletal pain, digestive problems, gastrointestinal problems. That can lead to absentee at work, poor morale, yes, and relationship conflicts. These are the moderate. And loss of productivity at work, yes, loss of productivity. And when you talk about the high cost, what is it? What is cost more in providing the quality? You have a high stress, major depression, schizophrenia, bipolar disorder. These are major. Obsessive compulsive neurosis, panic disorders, anxiety, bulimia can lead to cardiovascular, cancer, diabetes, asthma, back pain, alcoholism. It can lead to all these things. That can lead to ultimately low productivity, divorce, turnover, early retirement, workman's compensate, claim workman's comp, disability. That's going to affect the overall cost of the to the industry or factory. So once they claim workman's comp disability, I've had one patient, one employee, she claimed almost $300,000 in workman's comp disability. She, young woman, she was going back to Mexico back and forth. She claimed with children. We documented. I had an investigator, and we documented. She was going back and forth to Mexico after claiming disability from work. That's how they abuse it. So that leads to abuse of workman's comp. I would like to see workman's comp and health insurance, you know, interlinked somehow, because that makes the employers uh, work, which is makes it easier to manage overall healthcare quality. What is the highest extra high cost that can extra? What is the extreme, like extra high cost, is violence, suicide, yes, and it can lead to accidents, burns, it can lead to death, work violence, disaster recovery. So these are the things, the simple mental health things can cost the factories, cost the industry, cost the society. Mental health issues are not character weaknesses, folks. Don't misunderstand me. They're not character weaknesses. Like most of the physical health illnesses, mental health is a disease, and is treatable. As of mental health of American axiom states, you cannot have a health without a mental health. Physically, we may be fine. If you're mentally sick, that can lead to a lot of other things. So, physical health is no good without a proper mental health. Remember, quality of care. Quality of care is so important at affordable, which has to be affordable for, especially for the lower income folks. Quality of care goes beyond provided credentials. And medical results is too early to fail. It changes the entire society. It changes the how you give the medical advice, then how you give the informed options, alternative treatments, and a good bedside manners, and more and more. So the quality of care is important, folks, and it has to be affordable, focus on people who need the most. The affordability is very important. I will talk about the affordability factor in the next topic, but the quality of care is the best when it's affordable, and it has to be accessible irrespective of the class or creed. I don't like this bronze, silver, gold model. I don't like it at all. You're creating the class stress. Give them the personalized health insurance for all Americans, folks. Thank you for joining. I welcome you all. I love you guys. If I can get some feedback, I need a feedback. I'm I'm basically starving for the comments, folks. I really need some comments. I you know what? I love when people criticize me. I love it because I take it as a good thing. Anytime people critique you, that's a good thing. It it changes you. It changes your behavior changes, and you want to be better. And that's what the beauty about being criticized, folks. We will see you again 7 o'clock every day, yes, every day on healthcare. I'm not sure on Saturday and Sunday, but I'll try to make an attempt. But weekdays, every weekday at 7 o'clock. This is Consumers Doctor, a volunteer for Foremost Organization. We will change the human behavior, and we need to reinforce personal responsibility, folks. It is so critical. Thanks again. We will see you tomorrow.